Hi, good morning. My name is Coral Olazagasti, and I'm a medical oncologist from the University of Miami. I see mainly thoracic and head and neck oncology patients, and I am asked today what is one of the main barriers for lung cancer screening uptakes in mainly the underserved minority population. And I think when we talk about lung cancer screening and the barriers to screening, there's different levels that take into account what these barriers are. And so there's barriers at the levels of the providers. A lot of the PCPs are not aware of the guidelines, and also a lot of the PCPs are not aware of coverage by insurance companies, and also oftentimes they don't really know what to do with a positive nodules or abnormal finding. And so I think it's important to create education for PCPs and other primary providers to understand the guidelines and be able to refer patients for lung cancer screening. On the other hand, at the level of the patients, there's other barriers, right? There's barriers to access, there's barriers in eligibility criteria, and I think this is something that we can do better. Recently, the USPSTF liberalized their guidelines, hoping to be able to include more high-risk individuals, mainly African Americans and women, because they knew that we were leaving out a lot of high-risk patients at lung cancer because of the rigid criteria. And I think this is a step in the right direction. However, not everyone that's eligible gets screened for lung cancer, I think. So it's important to take into consideration social determinants of health, being able to implement screening, and also just go out there in the community and find these patients and be a pathway for screening and facilitate screening for these high-risk individuals.